One of the most major areas of racial segregation and least noticed has been healthcare. Racial differences in most health outcomes, from life expectancy to an infant mortality rate, are very obvious. This type of segregation is somewhat discussed in health policy debates, but segregation in healthcare is rarely ever discussed. No matter where Black people went for healthcare services, it would always be subpar compared to white people. Also, during this time of segregation, Black people lived in much more dangerous and unhealthy areas than white people, meaning that they needed much more healthcare services. But these services were either not given or given at very low quality. The hospitals that did happen to provide service to Black people were very segregated, understaffed, and under-resourced. The number of Black physicians never even came close to matching the required amount for such hospitals. There was not much healthcare integration. However, the Affordable Care Act wanted to change that. As well as making healthcare much more affordable, the ACA wanted to make it easily accessible to people of color. Unfortunately, Southern governors opposed the ACA. Most of their states had very large Black populations as well, which meant Black people or people of color were unable to afford health care.
Racism altered everything. In the book, The Immortal Life of Henrietta Lacks, we are presented with examples of Henrietta's experience with the segregated medical care. Johns Hopkins was the nearest major hospital in 20 miles that Henrietta attended. This hospital was a charity hospital for sick and poor. Most patients attending Hopkins were Black and poor. Also, they were unable to pay medical bills. On page 15, it states, this was the Jim Crow era. When Black people showed up at a all-white hospital, they were sent away, even if that meant they would die in the parking lot. Henrietta, during her visit, was taken to a colored-only exam room. Henrietta said that she only went to Hopkins when she felt as if she had no other choice. She described her visits there as feeling out of place, as if everyone spoke a foreign language, due to the fact that she had a very low education level and everyone would use medical terms. That is why she wouldn't go to her checkups until she thought she had no choice. At that point of her return visit, she sat there with a full-fledged tumor.